I love this show. From one topic to the next. Next up, we're going to be talking about skincare, but really unique ways to take care of yourself, whether it's inside or outside. I am joined by Sunny Kim, a registered nurse and CEO of SKin Phi Clinic. Welcome.
Hello,
great to have you here.
Thank you. Thank you.
Welcome back, I guess I should say. Right? You haven't been on here for
years and years and years.
Like I would say probably 8 years ago, 9 years?
More than that.
Oh my goodness, let's not age ourselves here, Sunny.
We'll date ourselves.
But this is a relatively new business, right? About 6 months old. Tell me the story behind it.
Yeah, so the SKin Phi story is myself and my partners, we have really rich experience in working with one of the pioneering laser dermatology facilities actually in the country. So Laser Derm, recently Dr. Lachlan, who is our mentor and boss, is retired, and we felt we had something really special to offer, and what we tried to do was take all of that vast experience and knowledge in working with laser science, laser medicine, and dermatology, cosmetic dermatology, and we wanted to distill it down and simplify it for many patients, because it can be daunting. It can a lot of people will come to us and say, I know I need things, I know I want to take care of things, and it can be intimidating sometimes even to figure out, where do I start? Where do I begin?
Well, and I think you also see, the mistakes that have been made in the past, and because of social media now, you see anything. So I think that intimidation certainly is there. Yeah. But I think, what do you call it? Minimalism in aesthetics?
Minimalistic, yes. So that what we wanted to offer was it doesn't have to be complicated. And this stems from skincare to procedures and then maintenance, when we're talking about taking care of your skin so that you optimize health, and also the aesthetics. I mean, people, if you look at the makeup industry, billion-dollar industry, it's and a lot of our patients, honestly, it's about trying to simplify their routine so that they can wear less makeup. So doing things that optimize your skin health, but also simplify the need for it. Maybe you don't need all that foundation or lots of concealer just on a daily basis, because people are busy.
Yeah, for sure. You mentioned laser, so tell me a little bit about the power of light for us, for people that don't understand. There's a lot of science behind it, isn't there?
Yeah, so my background is I started out in clinical dermatology with Dr. Lachlan years ago, and then I left clinical practice and worked in industry for a while, so with a couple of different laser manufacturers, and so my role really was in clinical education for many physicians and nurses across Canada and the US, and so laser physics is near and dear. I'm a bit of a laser nerd.
Nice.
I love it. And one of the things about Laser Derm in terms of where we come from is it pioneered laser surgery for things like birthmarks. So the port wine stains, when you see the little babies born with the red birthmark, that's just a collection of tiny, tiny little microvessels, little capillaries that are dilated, and it makes the skin appear red or pink in those areas.
And I think we actually have a photo of laser treatment. So if you just look at the monitor here, everybody at home, you can see the difference it can make. And this is done with laser treatment?
This particular procedure is done actually using an intense pulse light. So a variation of kind of using so laser stands for light amplification by the stimulated emission of radiation. That simply means one beam, it's like Star Wars lasers.
Yeah.
But you have very precise, collimated, coherent beams of light. And when we use them in laser medicine, we figure out what are the targets in the skin. We call them chromophores. So what are the colored bodies in the skin, and what wavelength of light or photons do they absorb? And anytime that you have photons absorbed by a body, a structure, it then gets converted to thermal energy. So we're in essence thermally targeting structures that we're trying to either fade, clear, or treat in the skin. So with things like port wine stains or rosacea, in that image where you saw there were a lot of little blood vessels in the before picture, and they're magically faded and cleared in the after. It's because...
What about maintaining that look? I mean, you brought some products. I mean, are these some of the products that you would use to maintain something like that?
When we talk about photoprotection, this is anybody who comes to us saying, I want to make my skin better, healthier, we always talk about sun protection. So we know that ultraviolet radiation, it kills everything. It kills collagen, it kills elastin, it causes deterioration. We can see brown spots and dyspigmentation of skin. And then the most important part, the malignancies, the skin cancers that they cause. So we do a lot of education around this. Is a very, very simple behavior that if you were to adopt can save yourself a lot in terms of potential malignancies, disease of skin, and also it accelerates the aging of skin. So we tend to favor zinc-based products, and zinc no longer needs to look like, it doesn't need to look like the lifeguard nose. It's not your grandma's zinc anymore.
Right.
So we kind of curated our favorite zinc products, which are great for the environment, great for sensitive skin, so we don't have to worry too much about rashes and sensitivities for patients, and acceptable cosmesis. So that means ones that our patients are willing to put on every day habitually for face cream, because that's important.
Another philosophy you have is sort of rejuvenation by moderation, right? What do you mean by that? Because maybe people think, because I think you touched on it before, I've got to do all of these, things before I can even, start putting makeup on and leave the house, right?
Correct. Some of our patients come because they have a very specific concern. I don't like this brown spot, I don't like this red spot on my skin. We can address those things. We talk about what the potential treatment options are. We try to give lots of different options based on their medical condition, based on their medical candidacy.
And this is this all, sorry to interrupt, but I just want to make sure I get that across before. Is it all non-surgical?
This is
sort of
non-surgical,
non-invasive, right? All of the procedures that you offer.
Correct. So non-invasive, meaning there are no sutures, no stitching, no cutting, no. And if patients require something that is surgical, then we help to direct them to some of the plastic surgeons or specialists in town who.
Sunny, where can people find you?
We are at skinphi.ca is our web URL, and our physical clinic is just on the close side of Canada. So
Excellent. Thank you so much. Great to see you again. Sunny, we'll be right back after this.